An omentectomy procedure added to Roux-en-Y gastric bypass surgery significantly improved glucose, lipid profiles, and adipokines at 90 days, based on data from a randomized controlled trial.
For Global Medical News Network, I'm Heidi Spleet, reporting from the annual meeting of the American Association of Clinical Endocrinologists in San Diego, California. Why was it important to conduct this study?
I think it's very important that we understand the contribution of having excess abdominal adiposity to cardiovascular disease. This study was very unique in the sense that it allowed us to assess the benefit of removing adipose tissue from the intra-abdominal area. This was done in conjunction with bariatric surgery, where they removed the omentum, which is a part of the intra-abdominal adipose tissue, and we were able to assess the metabolic impact of removing that tissue. And we know from multiple epidemiologic studies that intra-abdominal fat is a significant risk factor for cardiometabolic disease. Our key findings included improvements in glucose homeostasis in the group that underwent omentectomy. There was a significantly decreased fasting glucose. In the treatment group, we did not, however, see a statistically significant decrease in fasting glucose in the control group. Furthermore, we saw improvements in lipid profiles in the treatment group that were not seen in the control group. Lastly, we saw a favorable impact of omentectomy on the ratio of high molecular weight to total adiponectin. This ratio has been shown to be quite important in cardiovascular disease. It's important to keep in mind that this is one of several trials that have looked at this. Our findings were noted at 90 days. However, there are trials that have looked at omentectomy in addition to Roux-en-Y gastric bypass, where we have long-term follow-up data. Long-term follow-up data suggests that this is not a beneficial procedure to add to Roux-en-Y gastric bypass. However, in subjects who are undergoing gastric banding, omentectomy has been shown to be beneficial in long-term follow-up studies. However, more studies are needed in that population to validate that finding. At this time, our findings do not indicate that omentectomy should be routinely added to laparoscopic Roux-en-Y gastric bypass, and we await further data to clarify whether subjects undergoing gastric banding will benefit from this procedure.